In this video, I'm going to introduce you to our first care pathway, also known as guided treatment. Hopefully it will prove useful in the initial assessment of patients with potential COVID-19. I've logged into PowerChart and I've gone to the clinician workflow, where you would normally find your clerking, post-take and progress workflow end pages. You will notice there is a new end page available, the COVID-19 workflow. If you do not see this, click on the plus and select the COVID-19 workflow to add the tab to your view. If you're working in an area such as the respiratory assessment unit, where you may need this frequently, you may even wish to move this tab to the left-hand side so that it's the first one that opens. Having selected the COVID-19 workflow, you'll see a couple of new components in the workflow end page. The first being the Carepathway component. Now, as COVID-19 is our first care pathway, there is only one available pathway, and I can select this by clicking Start. I'm then taken to the guided treatment workflow, where the first question is there a high suspicion of COVID-19? If I was to select no, the pathway would end. Having selected yes, initial recommended treatment options open, which you can see here involves the COVID-19 investigation care set. This is the basic investigations to help me make my initial assessment. I can select this by clicking Order All. This should match the current paper pathway used in the respiratory assessment unit and other medical areas. If, for my particular patient, I don't need any of these orders, they can simply be deselected. You'll see that I have 8 orders to sign at some point in my inbox. I can start to answer some of the questions. So let's say my patient has a fever higher than 37.8 degrees, clinical evidence of pneumonia, and perhaps some new hypoxia. At any point, I can save and if I or any other practitioner comes back to the COVID workflow for this patient, they'll be able to carry on and complete the pathway. So I'm going to sign off my orders. And once any missing details have been completed, I can sign. I now return to the COVID workflow. And continue to clerk my patient as normal. And I can then create my COVID clerking note, which you'll see looks very similar to our other clerking notes. But here we have an update on the care pathway. We can see the patient started on the pathway on the 20th of April. And so far we have a high suspicion of COVID, the symptoms that I filled in, and one thing from the past medical history. So I would sign that note as usual. And now perhaps I'm going to come back and review this patient, because let's assume I've got some lab results back and perhaps that chest x-ray. So back in my Carepathway, I can now open. Things previously entered are saved, regardless of who the user is, and I can now complete the rest of the guided treatment questions. So I've already said that my patient has chronic renal impairment, perhaps they have COPD as well, and they have come from a nursing home. They come from a nursing home. Now I'm ready to complete the triage form. The pathway tells me to click here. The form will open. It will bring in whatever the latest respiratory vitals are, known to eCARE. And if the patient had had any previous COVID swab results, we'll also bring those in. In line with the current paper pathway, it makes suggestions of which patients should be considered for discharge versus those who need admission. So if my patient could be discharged, and I'm happy with that, I would select discharge. There's a further question here about how long the patient had had symptoms, and then I can sign the form. And there's one further question: am I going to discharge or admit? If I discharge the patient, you can see here that another plan has been suggested, and this is the Respiratory Assessment Unit TTO pack. So if I need any medication for the patient to go home, again, if I go to my inbox to see orders for signature, I can then select medication that is available in the Respiratory Assessment Unit TTO packs, and having selected that, when the pop-up appears, I would select nurse to dispense. This way the patient will get their TTOs in a timely fashion. Now, if perhaps my patient is actually a bit sicker and needs admission, you can see here suggestions to consider if the saturation can't be maintained at 92%, there are infiltrates on a chest x-ray or high risk of comorbidities, then admission might be more appropriate. I admit the patient. I'm presented, you can see, with a different management plan. And if I select this and go to my inbox, then I get some advice about initial treatment for a suspected COVID positive patient. This will include ordering the specimen, if they've not been done already, adding the isolation indicator to their record, a prompt to check their resuscitation status, complete a frailty assessment, VTE prophylaxis, oxygen therapy and the associated monitoring plan, nebulizers if required, consideration of intravenous fluids, and some paracetamol for pain. If there's a suspicion of bacterial infection, then you may want to consider antibiotics, but you should follow the local guidelines for the management of community-acquired or hospital-acquired infection, and these can be found in RX guidelines. Having completed the initial guided treatment, you can return to your COVID workflow, amend any of the text boxes, and then create a COVID-19 review note, where again The Pathways current visit has now been updated with the rest of the questions I answered and the outcome from COVID triage. So in summary, this is quite a simple, short pathway, but hopefully it will manage in the initial triage of suspected COVID admissions, as well as acting as a timely introduction to the Carepathway tool, where we will hope to be launching further pathways, for example, fractured neck of femur, stroke, etc., over the coming months.